This is my disclosure. I'm chairman of the Society of Laparoscopic Surgeons, and one of the reasons I'm here is several years ago we realized that endometriosis is a multi-specialty disease, and we needed to train the next generation of endometriosis surgeons. So along with Far Najat and a committee of experts from around the country and around the world, we established the first multi-specialty endometriosis fellowships. One at Stanford, one here in New York, one in Atlanta, and another in Orlando. And we're now in our second year of those. And the idea is to expose fellows to a year of intensive training in minimally invasive surgery with expertise in not only gynecology, but in general surgery and in endourology. And I'm pleased to report that those programs are going well and will soon be extended to other locations. SLS also has another important fellowship, and that's in simulation. This year, our simulation fellowship with the University of Minnesota is now going to be in the University of Washington in Seattle with Rob Sweet. And the idea behind that is related to a lot of things that you saw this morning. Those things related to pilots learning by simulation and that sort of thing. And one of the comments was made that we don't quite have the simulation yet that duplicates what you would see, but in fact we do. And one of the first that was presented last year at MIS Week, which is the annual meeting of SLS, many of you saw, was the bleeding vena cava simulator. It was so realistic that two of the residents who were being checked out in the simulator got dizzy and almost passed out when the blood started to flow. It looked as realistic as what you see there. So that's my disclosure. My other disclosure is I love Apple. So Samsung, they make great TVs. They have nice displays. And I love Google. They have great search facilities. But I really love Apple. So some of my talk may be geared more towards Apple. But I think that's because Apple has shown over and over again that it has the ability to advance computer technology and interface with people. And that's a little bit about what I'm going to talk about today. So get back here. And so we live on this little marble that's going through space. And today, we're here in New York City. I live in Miami. And a few years ago, I would be giving a talk like this in one part of the country or one part of the world, and people may never hear about it or understand what's going on anywhere else. It's very different today. Today, through the internet, we can be speaking in New York City, and people in Beijing can hear this or see this or know what's going on. So information's traveling. Our little blue marble that's traveling through space, there's a lot going on, a lot of networking and communication around the world that's bringing knowledge and information. And this is just part of what's happening with the connection of technology. Did I just lose my sound? No. Okay. These are words that did not exist when I was born. The world's changing very fast. Even within the past year or so, there are hundreds of new words related to technology and things that are changing very, very rapidly. So most of us look at the issues that we're dealing with, things like endometriosis, and saying, where are we today? What do we know today? Or with our surgical techniques and the tools, where are we today? What do we know today? But what we're losing track of is the fact that things are always changing. We're in a little time capsule that's moving along. And what we have today is not important. It's where we're going that's important. One of those things is nanotechnology. We're now able to make things that are very, very tiny. Another thing is related to this, 18 months. Who here knows the significance of 18 months? There's some young smarties in the back here. Anybody here, raise your hand. 18 months?
You're referencing Moore's Law?
Moore's Law. Oh, maybe. Or maybe it's the gestation of an elephant. Actually, 18 months is the gestation period of an orca, not an elephant. But what's your name?
Jason.
Jason. Okay, Jason, you were right. This is Gordon Moore, who is the father of Moore's Law. And Moore's Law says that computing power will double every 18 to 24 months. And computing power has in fact done this over several decades now. So it's really moved along very, very quickly. Before I went to medical school, I worked in a bank for 7 years. And this is our bank in the late 1960s. This is, before this computer was put in, so it was a room this size with all these IBM mainframe computers, those little disks. Do you want to participate? No, I don't. Why would I want to do that?
That's what happens when you mix Apple and Microsoft.
Oh, so it's Microsoft, I'm telling you.
You're in computer purgatory.
I'm telling you. But here's the beauty. I can recover quickly. So it was a room this size, and each of these disks held a few megabytes. But before these disks, the tellers in the bank, there were two things that went on in banks. Those were before the big banks that were too big to fail. These were regular savings and loan banks. And so they took savings from people in the community, and then they loaned it to other people in the community to build houses. But every day, the tellers, if they were a penny off, they did this by hand on ledgers. If you withdrew $25, they didn't have ATMs. You went into the bank and said, I need 50 bucks. They had to write on a little card that was your ledger card. It was like medical records before digital. You had to write it on a card and add it up. And if they were a penny off, they had to stay all night. These computers were so smart that they could add and subtract all those cards. That's all they did. But it was a big thing. So here's one of the ladies that worked there. And the disk she has is a magnetic tape that held about 28 megabytes. The computer itself stored information on big steel drums. Excuse this slide, but look at this slope that's going up. This is where we were when we had the IBM mainframe computers. They were as intelligent as a nematode or a bacterium. This is where we were when the first Mac computer came out. Remember those little Mac computers? They looked like ET. This is where we are today. This is where we're going to be within 2 years. This is where we're going to be within 4 years. Actually, no, we're going to be more like this. Your mobile phone, the phone in your pocket. How many people here have the iPhone 6? 3 billion with a B. You have 3 billion transistors in an iPhone 6. It's amazing computing power. Our mobile phones now have more computing power than all of NASA had when they launched the man to the moon. Here's for those of you who are interested in operating a lunar lander, here's the operator's manual. This is the Houston Control Center when they launched the man to the moon. All these engineers at all these computer terminals, if you added up all the computing power in there, plus the power of the rocket, plus the power of the lunar lander, plus the power, any radio control stuff on Neil Armstrong, it's a small fraction of what you have in your pocket today. In fact, these supercomputers in our pocket are more powerful than the computers that were used to solve the Human Genome Project. It's amazing computer power, and it's that and the nanotechnology that are causing some amazing things to happen that are going to affect us all. So they're about to collide. Nanotechnology and computing power. It's an amazing thing that's going to happen that's going to change everything, and the change is not coming from the inside of medicine. Most of us within medicine are unaware that this tsunami is about to hit. Just like the cab companies, how many people took cabs today? How many took cabs today? Yellow cabs. How many took Uber? Okay, those yellow cabs lined up down the street 2 or 3 years ago. They were worried about the cost of cars and the cost of tires. Today, they're worried about the cost of cabs and the cost of tires, and they have no idea what's happening. Uber's taken over because it involves using technology, aerospace technology, GPS systems, and systems that just didn't exist, and supercomputers in our pockets. So let's talk about app developers. I'm an app developer for Apple, and I thought that was a pretty big deal. We developed some of the first medical textbooks and journals. And I go to the Apple Developers Conferences, and I was there in 2014 when Tim Cook, the president of Apple Computer, got up on the stage and said he'd like to welcome the 9 million app developers, up 47% from the year before. Today, that number is 15 million. So there are 15 million people worldwide and growing who are working and developing apps to make this supercomputer do super things. And out of that, a percentage are working on medical things. So there's the group from Flutter that's here today. You guys are here in the room? Back in the room? But there's thousands and thousands of people. So I've done some work and originally worked on the original design for the Endosphere and some of the instruments back in the 80s that Harry and I used. And all the biomedical engineers in the world are a pinhead, and all the app developers working on medical apps would fill the Empire State Building. So these are medical apps and science apps. So what's the problem? What's the problem with medicine? What was the problem with yellow cabs? Why is Uber so much better? Do we really have problems in medicine that need other things to come in and disrupt us? Well, according to JAMA, 10 to 20% of the cases are delayed or have an incorrect diagnosis. According to the Institute of Medicine, nearly half of American adults have a difficulty understanding and acting upon health information. Human doctors have cognitive limitations and cognitive biases. Here's a study from Cleveland Clinic that was published, and it showed that 11%, this is people who had initial diagnosis and a second opinion. Now, these are second opinions with experts. 11% of the second opinion disagreed with the initial diagnosis. 15% found the need for further testing. 18% recommended a major change in the treatment plan. 26% recommended moderate changes to the treatment plan. 22 minor changes. The good news for us is only 5% of the patients switched doctors after all this. But is medicine a science or an art? What part of medicine is a science? If we're a science, why aren't we all giving the same diagnosis? Why aren't we all coming up with the same treatment plan? That's a problem. This is my favorite, math. The other 50% are not in this room, don't worry. Here's another scary thing. These are 58 experts. So 58 experts in breast surgery were asked to estimate the chance of a spontaneous rupture of a silicone breast implant. And here are the answers. They all gave basically different answers all across the board. So again, are we a science or an art? Is the art of science the ability to communicate with patients? That's good. But the art of science shouldn't be guessing about what outcome or result or understanding what happens. So here's what's happening. This is the American Canyon, Napa Valley in California. And about 2 years ago, there was an earthquake. Do you guys remember seeing that in the news? There was an earthquake there. So an interesting thing was happening during that time. There's a company, how many people wear Fitbit or Jawbone products? A lot of you, okay. So there were about 300 people in the region who were wearing things like that, sensors on their body. And as you know, some people wear them to, medical people don't know this, but some people wear them to see how much sleep you're getting and how soundly you sleep. You guys wear them to see how far you're walking every day. There were 300 people in the region, and at 3 o'clock in the morning, at the server back at Jawbone headquarters, they saw this spike. They knew, before all those people knew, or anybody else knew, that something had happened to wake all those people up simultaneously. So imagine, how many people have Apple Watches? No Apple Watches? One Apple Watch. Okay. Within a couple of years, we're all going to be wearing some sort of sensors. This nanotechnology is creating thousands of kinds of little tiny sensors that are very inexpensive that you can wear to measure pulse, oximetry, electrical conduction, body temperature, things like that. So imagine within a year or two, we're all wearing some sensor, and in Chicago, the CDC is noticing on the servers that there's a little, at that table, somebody had an unusual fever. And then 2 hours later, they notice that the next person over there has another unusual fever. I'm pretty convinced with all that. By the way, how many times a day do you check your postoperative patient's temperature when they're in the hospital? Just blurt it out.
3 times.
3 times a day. When you send them home? None. Post-op infections happen sometimes? How do you know about them? And says, I have a high fever for 4 days, I tried everything else, and my stomach hurts. Within a year or two, all these patients are going to have sensors. They're going to go home. Before that patient gets any symptoms, they're going to get a notice on their phone. I've called Dr. Sechen's office and made an appointment for 2 o'clock. You may have an infection starting, but we can nip it in the bud, no problem. Come in and we'll take care of it. The people in Chicago who have a fever, I'm pretty convinced with that much data. These are sensors that are going to be checking pulse and temperature every second, 24 hours a day. With that much big data, I'm pretty convinced that Ebola will have a different fever curve than the common cold, which will have a different fever curve than influenza, and the CDC will know by the time the second person gets an infection where they are and what's going on, just like the Uber driver knows where you are. So we're entering this brave new world of technology, and it's happening fast, and it's happening from the outside of medicine, and it's going to disrupt medicine the same way that the Uber has disrupted the cab companies, in the same way that Apple has disrupted music, in the same way that Amazon and books, and I could go on and on and on. So here's some things. This is an infrared sensor that works with your phone, so you can see hot spots in the body. This is everything you would find in an ICU 10 years ago, you can now do on your phone. This is a guy in a little village in Africa getting a glaucoma test. Little shout out to Samsung, they do some good things. This is a spectrometer. It can tell you that, what do you have in there? Are you having the tuna? It'll tell you exactly what's in your food and all the different chemical components right to your phone. Oscilloscope. So then there's some apps that are starting. One of them is Safe Start, which is a surgical app that does informed consent. It has pictures of the patient. The patient identifies that their right knee is sore and they circle it. When they get to the operating room, everybody has a copy of that. So the idea here is to eliminate wrong site surgery, which is still a problem even with timeouts and checklists. By the way, we use the airplane and the analogy of the airlines for medicine. We've all started to do, we've worked a lot with OR already and things like that, and we've started to do checklists, WHO checklists, timeouts, things like that. The big difference in the airplanes today, when Sully Sullenberger landed his jet on the Hudson, computers. They have computer sensors for everything. And so that's been, those things that we're starting to implement helped a lot, but they weren't the final thing that really made airlines so safe. The final thing that made airlines so safe is computer technology and the ability to track things and to control the plane. And you all know about Google and Tesla and the automated cars, and the number one thing they say is they're safe, there's no human error. Theoretically they'll be safe. So we have things like this, but the ability to now implement some of these things is amazing. Here's another one where you can take pictures of your patient, communicate things to the outside world, and then it sort of disappears. Sort of like, is that Snapchat, or which one of those is it where yeah, it was before Snapchat. So here's the Apple Watch we spoke about a little bit, but the sensors, every iteration of these are going to have more and more sensors telling you more and more things. And so there's a lot of folks around, like the Flutter group, who are trying to collect data now with endometriosis through collecting data. So this is the research kit that Apple developed. Now, I have the iPhone 5. I've ordered my new iPhone SE. I just like the small phone. So I should get that by the time I get home. But those of you, who has the 6s again? Okay, you guys all have the M7 chip in there. The M7 chip tracks your health data. It's an entire processor with billions of little things on it that track that. So there have been a lot of institutions now around the country that have started this, but this is something that's accessible to all of us. So there could be things that work like Flutter's doing, and things that work with ResearchKit to develop apps that go on the phone that your endometriosis patients could have, and you could track and collect data from. And the advantage of this is, instead of you getting 20 patients in your practice, this will attract thousands and hundreds of thousands of people around the world and give you tremendous amounts of data very quickly that'll help solve some problems. This is a little more of the kinds of things they could do. There are now apps, you know, for to understand the progress of Parkinson's. So somebody will take a pill for Parkinson's, and then they were supposed to come back in 6 weeks and let the doctor know how they're doing. Now they have an app where they move their finger on the thing, or they do some little thing on the phone, and it can tell the differences. It can tell how effective the medicine and how effective it's working. Imagine that with treatments for endometriosis and how those things might work. So it's a brave new world. We don't know exactly where we're going. We don't know exactly what all the apps are going to be, but there are a lot of things, and it's going to change everything in a big way. So I encourage all of you to, those of you who are not computer nerds, to hire the kid that's tinkering in his garage next door and put him on your team, or she. Get somebody involved in any of these projects you're doing, because this is the thing that's going to happen. Don't be that line of yellow cabs sitting there on the corner, because this is happening. The AMA hardly knows about it. ACOG hardly knows about it. But it's going to change all of our practices. It can change medicine. A lot of patients that you see are going to be treating themselves at home with apps. And just like Uber, it's hard for us to believe, but doing a better job of some of these things. So I'll leave you with these thoughts of these words and all the new ones that we can hear over the next couple of years. Thank you.